If you are watching this video, you may have had a missed miscarriage recently. We're so very sorry for your loss. A missed miscarriage happens when your baby dies, but you don't have any signs or symptoms of miscarriage. Most people find out at an ultrasound scan, which can be a real shock. After a missed miscarriage, doctors will need to make sure the remains of your baby and pregnancy tissue are no longer in your womb. This is sometimes called management of miscarriage. As your baby died when you were less than 14 weeks pregnant, there are 3 ways this can happen. These are called expectant management, medical management, and surgical management. The risks of infection or other harm are very small with all 3 options, and your chances of having a healthy pregnancy next time are the same with each method. Medical management is where you take medicine to help the remains of your baby and pregnancy tissue come away from your womb. You may prefer this if you don't want to wait for the miscarriage to happen by itself and you don't want surgery. NICE guidelines recommend that you are given 2 drugs. You will take mifepristone first and another medication called misoprostol 48 hours later. This is more effective than just taking 1 drug. After taking misoprostol, usually as a pessary inserted into your vagina, it can take a few hours for bleeding to start. You will also have pain and cramping. Many people say it feels like very strong period cramps or like early labour pain. You will bleed from your vagina, probably quite heavily. You may pass large blood clots and tissue. It's possible you may see something you recognise as a pregnancy sac or your baby. This can be distressing, especially if you're not expecting it. After taking the second medication, it will usually take a few hours for the bleeding to start. Bleeding will be heaviest for the first few days, then it should get less and stop within about 2 weeks. Medical management is successful in 85 out of 100 people who have it. These decisions can be difficult, especially so soon after finding out your baby has died. Your doctor or nurse should explain if any options are not suitable for you and why. They should give you the time you need and answer any questions you have. You may want to ask them more about the risks and recovery times. You can read more information and find help to decide which option is best for you on our website.